We know that it can be stressful when your child has surgery, even when it's just a small procedure. This video will help you know what to expect the day before and the day of surgery, so you will be more informed, be better prepared for the day, and be able to answer your child's questions. It is very important that you and your child follow the instructions you were given about eating and drinking on the day before surgery. Your child cannot have any solid foods, gum, or hard candy after midnight on the night before surgery. Until 6 hours before surgery, your child can have milk or formula. Clear liquids can be given until 2 hours before surgery. Your child should take prescribed medications as normal unless otherwise told by your doctor. If these instructions are not followed, your child's surgery may be delayed or canceled. Please call your surgeon's office if you have any questions about eating or drinking the day before surgery. You'll want to prepare all the things you and your child will need on the day of surgery, like your child's insurance card and a list of all medications your child is taking. This includes medications prescribed by a doctor and over-the-counter medications like vitamins. You can also bring a toy, bottle, or blanket to make your child more comfortable. When your child's surgery was scheduled, you received paperwork at the doctor's clinic or by email. This paperwork has the arrival time for your child's surgery and tells you the correct location for admissions. There are 3 locations for surgery at Texas Children's Hospital in the Texas Medical Center, as well as a surgery location at our West Campus Hospital. Please call your surgeon's office if you are not sure where to go on the day of surgery. On the pre-surgery instructions, there is an arrival time listed. This is the time you should arrive for admission. Please plan for plenty of travel time in Houston traffic. On the day of your child's surgery, you can use our valet parking service at no charge. Once you enter the hospital, follow the dragonfly, frog, or fish icons to your surgery admissions location. There will also be greeters in blue vests who will be expecting you for surgery and will direct you to the correct location. When you arrive at admissions, check in at the front desk. Medical information is sometimes difficult to understand. If English is not your primary language, you can ask for a translator to interpret any information for you in a language you are most familiar with. After registering, you and your child will be taken to the pre-op area. In this part of the operating suite, many people will talk to you and your child and ask many questions. Hospital staff will ask your name and your child's name, and about the type of surgery that your child will be having. They will ask about when your child last had anything to eat or drink, and about any allergies your child might have. Many people, such as nurses, anesthesiologists, and doctors, will ask these questions. This is to double and triple check facts, making sure your child's surgery is as safe as possible. Nurses will also confirm that you have signed all of the consent forms for surgery at this time. If your child is anxious or nervous about being in the hospital, we have child life specialists who can help your child feel more comfortable about being here. Next, you and your child will meet with an anesthesiologist. This doctor will give the medicine that makes your child feel no pain during surgery. The anesthesiologist will ask questions about your child's health and any history of previous surgeries. Next, your child's surgeon will visit to discuss the surgery. The surgeon may also mark the part of the body to be operated on. This is just another way to put your child's safety first. Once all of the pre-op activities have taken place, your child will be taken to the operating room, and you will be escorted to the waiting area. While your child is in surgery, it is important to tell the waiting area staff if you leave the immediate area. The surgeon and nursing staff will need to be able to reach you during and after the surgery. Please keep in mind that you will be at the hospital for several hours. It's good to bring reading material and other activities for you to keep busy while your child is being cared for. Even though brothers and sisters and family members want to be there with the child having surgery, we have found that it can be difficult to keep young children occupied for long periods of time in the waiting area. Many parents find it less stressful for themselves and for the child having surgery to plan other activities for siblings on that day. After surgery, the doctor will give you a report on your child. After your child wakes up, you will be taken to the post-op area to sit with your child. Nurses will visit with you to give you instructions for caring for your child after surgery. Once the nurses have given the okay and your child is alert, you are ready to be discharged and travel home. If you have any questions about your child's health on the days following surgery, do not hesitate to call the phone number in your discharge forms. We hope this video will help you know what to expect on the day of your child's surgery. Our doctors, nurses, and staff at Texas Children's Hospital are always here to serve our patients and their families.